And Democratic Congressman John Garamendi from California. What's your reaction to this, sir?
Well, it's exactly what we knew it would be. We knew there'd be enormous tax cuts for the super wealthy, and that men and women that are 50 to 60 are going 50 to 65 absolutely going to get harmed, and we're going to lose millions. In fact,
well, that's
CBO
actually,
says we're going to move.
That's not the group. According to the CBO report, they said that 14 million people would not have insurance, but it would be a result of not having the mandate, and people would choose not to buy it because it's not in their economic best interest. That's not Medicare or Medicaid. Well, that's just the regular mandate.
Whatever the reason, there are multiple reasons here. One of the reasons is the reduction in the Medicaid program. That's going to have a very significant long-term impact and some short-term. We certainly know that people that are 50 to 65 are in for a huge, huge hit. And we also know that we're talking about millions. We're talking about 14.
Where do you see that people that are 55 and 60 are in for a huge hit?
It's in the CBO score. You read the score. It's in the CBO score that there's going to be a very significant increase in cost in people that are 50 to 65. It's in the CBO score. You got to read the whole thing. 14 million people will not have insurance next year. That's huge across America. And then by 2026, they're talking 24 million people will not have insurance. So if you were looking for something that was huge, if you're looking for something that was awesome, well, this is awesome for those people. 14 million people in 1 year will lose insurance.
Do you think that the Obamacare, the way it is right now, would you leave it where it is, or what changes would you make?
Well, certainly I'd start with on the federal government being able to negotiate for drugs. I'd look at the various ways in which the insurance companies operate within the states, so that the insurance companies, so that your state exchanges operate in such a way as to provide multiple opportunities for insurance.
But how would you do that? Because the problem is that in so many states there is only one option, because the insurance companies are losing money, so they're all dropping out of the system, and it's in a death spiral. So everybody wants the idea of having more options in every state, but under the current system, it's getting to be either one or zero. How would you remedy that?
Well, I was the insurance commissioner for 8 years in California, and you can remedy it with regulations that the state can put into effect.
So force
and
them.
Yes, pricing. Yes, and if you're going to operate in the state, then you're going to have to meet certain requirements, and those requirements include coverage throughout the entire state, which happens to be a problem in California right now. But there are multiple providers, but in some places the insurance companies choose not to. Now, this happened wait a minute.
No, I just want to ask you more about that. I just want to ask you more. If you force the insurance companies to stay in a state and to offer the plans, how do you deal with the fact that they're losing money on the policies, or do you just allow them to charge a whole lot more, or do you have the government pay them? Because they're leaving because they're losing money. So if you force them to stay, how do you have them not lose money?
I'd be happy to answer it. You do it in two ways. One, the subsidies need to be adjusted across from state to state. You have to deal with the subsidies. That deals in part with the pricing, and the insurance companies have to have a reasonable level of premiums, and those need to be adjusted over the period of time, so that yes, the premiums may rise in some circumstances, but the subsidies should also. But the state insurance commissioners are in a position to regulate the insurance market in their state. And if they do so, and they can do so in a way that makes adjustments.
So the way to stop the death spiral right now and keep the system in place is to raise premiums and have taxpayers pay for that through the government. That's what you're saying.
You need to, listen, what is a death spiral? A death spiral is where you have adverse selection in among the various participants in a plan. And in this case, we're probably going to see even more of a death spiral with what is happening here, because the young and healthy will opt out.
Absolutely.
Leaving the sick. Now that's where you get a death spiral.
But it hasn't worked to force the young and healthy to stay in, because you can't make people do what's not in their economic best interest. I mean, that's the whole problem, is young and healthy people aren't signing up, even though you're trying to force them with the mandate, because they'd rather pay the penalty or just skate on the whole thing. You can't make people do what's not in their economic best interest.
In the case that we have here, you have a situation in which in the Trump-Ryan care program, you have a situation with a 30% surcharge when you enter back into the market. That is literally money that you're giving to the health insurance industry. Will it be sufficient to cause people to stay in the market? Well, the CBO thinks not. It remains to be seen. But the death spiral happens when young or when healthy people opt out. But what's happening here is you've got to find a way to keep everybody in. In part, that has to do with the relationship of subsidies.
Yeah.
Well, and yes, and make sure that there is sufficient premium made up of the subsidy as well as the pay that an individual is paying, sufficient to keep the insurance companies in.
Yeah, just raise everybody's taxes.
Well, now, wait a minute. Let's take a look at the tax situation in the Ryan-Trump plan. The Ryan-Trump plan has enormous tax cuts. In fact, the top 400 families in the United States will have a $7 million a year tax cut. The top 0.1% will have a $200,000 tax cut, and they'll consume 35% of the total taxes.
Well, there's also way too many rebates for everybody across the board, which is something that conservatives don't like about the plan at all.
Well, the tax cuts are clearly a huge gift to the super wealthy.
Okay.
The bottom 80%, get to share 25% of the tax cuts, and they'll wind up paying more for their premiums. So this is a huge shift of wealth from working men and women to the super wealthy.
Interesting interpretation.
That's what this is all about.
Very interesting interpretation.
No, it happens to be a fact.
Thanks for coming on, sir. We appreciate your time.